Next, we see the combined oral contraceptive. This, where what I've told you, it's a combination of progesterone and estrogen. Thus, it makes it a more effective pill combined to progesterone-only contraceptive. So this one, it prevents ovulation and is considered as the dominant mechanism of action. It's either estrogen or progesterone alone is capable. As I said before, any of the hormones will affect the follicular stimulating hormone and luteinizing hormone sufficiently to prevent ovulation. So when you combine the two, they create what do I want to say? When you combine the two, they will create a more effective block to the ovulation. So it's a more effective drug compared to the progesterone only contraceptive. So they also alter the consistency of cervical mucus, as we said. It thickens it and reduces its production. It affects the sperm movement. Also, it said it affects the endometrial lining, making it more thinner, thus lacking part of attachment if the ovum is fertilized. And also, we said due to the change of structure in the mucoid content, it reduce or it alter tubal transport of the sperm. So as we said, the efficacy rate of this is much higher. It ranges from 0.1% to 5% with typical use. So if you use it more disciplined wise, you take the right time, don't delay it over 30 minutes, it will be effective as 0.1%. That means less than one person will get pregnant in every 100 people. So it's like a 1 in 1,000. Some advantage of this is oral contraceptive are used in treatment of menstrual irregularities because menses is more regular and predictable. As I said, it has both hormones. So those people who use other family planning methods and you get hormonal imbalance, this will collect your hormones. This is the drug of choice we give to collect your hormones. Also, oral contraceptive will prevent benign conditions such as benign breast disease and pelvic inflammatory disease because they suppress ovarian stimulation by the follicular stimulating hormone and luteinizing hormone. Also, the oral contraceptive are noted to prevent epithelial, ovarian, and endometrial carcinoma. We have seen it affects how the endometrium lining weakens. So with that suppression, also, if you had cancerous cells, they will be suppressed. And that's in an extension, it will prevent you from endometrial carcinoma. Carcinoma is it's what causes, it's a cancerous cell. It's what causes cancer. So disadvantage is mostly, as we have said, of any pill, most of the medication that you take as a pill, it brings nausea. Also, it brings breast tenderness. It brings breakthrough bleeding. That's you can bleed at any time. Also, it brings amenorrhea, and also at times it gives headache. Other disadvantage is oral contraceptive. Both of them, they don't prevent or protect you from sexually transmitted diseases. Also, daily administration is necessary, and inconsistent use will increase the failure rate. You have to take it daily at this specific time. Otherwise, if you fail, again, you become viable to getting pregnant at any time. Having a few months of delay of normal ovulatory cycle may occur after discontinuation of oral contraceptive. Unlike the depot, which takes years, for oral contraceptive, you might take a few months, up to 5 months. The highest I've had is 6 months, but most of the people within 3 months or 2 months, you are able to regain your normal menstrual cycle and you are fertile as soon as you stop them. So it's, in fact, with irregularity, some people get pregnant. So it means without some people, the pregnancy comes in back as immediately as you stop them. Also, the other effect is contraindication to use include It has some contraindication. There are people who cannot use it. These are the people with cerebrovascular diseases. That's brain-related diseases. People with coronary artery diseases. Those are heart problems. People with a history of having thrombosis. That's formation of blood clots. And we said estrogen increases the thrombosis. So people with thrombosis, you try to avoid giving them something with estrogen, which combined oral contraceptive have both. Also, people with pulmonary embolism, embolism is related with a clot formation, so you don't give anything with estrogen. People with congestive heart failure, people with untreated hypertension, that means if you have treated and well-managed hypertension, you can give. People with diabetes, patient with diabetes with vascular complication. Those are patients with diabetes which shows any symptom of poor blood flow. People with estrogen dependent neoplasia also. People with breast cancer, people with undiagnosed or abnormal vaginal bleeding, or people known or suspected to be pregnant, people with active liver disease, or anyone above 35 years old, we try to prevent giving them. Some, once you teach them about the risk, we can end up giving them, but we try to avoid as much as possible. And also people with cigarette smoking habits, this is not our best method for you. So it's good to give light history to the person administering family planning so that they can be able to advise you whether it's safe or not safe for you. And whatever I say, when you are going for your initial treatment, don't do it in the local. We know like things like pills can be dispensed by the community health workers, but don't go to the locals. First, go to the hospitals for initial assessment, and then from there, if you choose to take pills, you can use them later. We see any method, including condom, before you use it first, you need to go for hospital assessment so that you can get to know that do you have latex reaction, such stuff. So any method before you use, we encourage you to go and get the initial management first in the hospitals, and then after that, you'll be advised if it's good to take from even those health promotion officers. We have also a combination patch contraceptive. This patch, it's one for 7 days for 3 consecutive weeks. By this, I mean you will place one patch for 1 week, and then after 1 week, you'll change to another patch. It goes for another 1 week. And then on the third week, you'll place another patch. It goes for 1 week. After you have covered the 3 weeks, you'll remove the patch and stay for 7 days without the patch. And then after the 7 days, again, you go to the patch for another cycle. So one cycle will consist of 3 patches, which you'll place on consecutive weeks, 3 consecutive weeks. After the 3 consecutive weeks, you jump 1 week, which you'll stay without. That's 7 days without the patch. We call it a patch-free week. And then after that, you go back to patch for the 3 weeks. That's how it functions. Mostly this is suitable for people who have a problem with taking the daily pills. Maybe those people who have who forget mostly to take pills. Again, its efficacy, effects, side effects are the same as the combined oral contraceptive. So they share the side effects, and everything. So we shall not go again about that. You can recheck on what we said about combined oral contraceptive. But the challenge we have, the combined patch contraceptive, it's not very readily available in most of the pharmacies and chemists. And also it's not available in our facilities. Again, we have another unique method which we call contraceptive vaginally. It's unique since it's reusable and biodegradable. So these are flexible vaginal that is placed in the vagina for 3 weeks and then removed for 1 week. So use the same sequence with the patch, but for this, you'll place for 3 weeks and then you remove for 1 week. And then after 1 week, you use for 3 weeks, you remove it for 1 week, and then after 1 week, you replace it again for another 3 weeks for another cycle. So the schedule is repeated for 4 weeks. It's repeated every 4 weeks. By every 4 weeks, I mean you put it for 3 weeks and remove for 1 week for 1 year. So it covers 3 menstrual cycles of 28 days each. So this thing, the most advantage of it, if you get one, you can be able to use it all for 1 year. And then you remove it for, after 1 year, you replace the ring again and use another fresh ring. So the efficacy and safety were studied in different facilities, and they were similar to those of combined oral contraceptive. But pregnancy rate was a bit slightly higher of 2 to 4%. So it has same advantage as combined oral contraceptive, and it's more effective and reliable. You don't need to remember to take the pill daily or to change the patch weekly. You just have to place it, time your timer for 3 calendar weeks, and then after the 21 days, remove it, stay 1 week, and then replace it after the 1 week. It has also more so same adverse effects related to combined oral contraceptive. Some few more effects includes it brings headaches, it brings vaginal irritation or discharge. Also, it might bring some vaginal infection. The ring also may accidentally slip out of, it might accidentally slip out of the vagina during intercourse. So increasing the risk of contraception. Always supervise your sheets, and if you're using this method, always supervise your sheets after every intercourse. Similar, it has other contraindication similar to that of COCs. So as you can see, they are all the combined hormones therapy. So they have all adverse effect and contraindication similar to the combined oral contraceptive. Thank you so much. Continue posting any questions. We are going to handle them in the next caption, in the next class. Or after we are done with I'm thinking of taking all the questions, and then I'll do the questions immediately after I'm done with the long-term methods. Thank you so much and enjoy your day. Thank you. Thank you so much for watching this video. I hope you have been enlightened. Kindly subscribe to have an access to more of my upcoming classes on diverse health and lifestyle tips. In case you have a specific topic you want handled, or specific question you would like answered, or even get clarification on something I've said on my videos, please drop it on the comment section and I'll be prompt to give you responses. For appointment and private session, contact me via details on the video and I'll be ready to assist you. Thank you again for choosing me to guide you on health and lifestyle. This is King Mash. See you on the next one.